Thank you so much, Catherine. I'm so happy to be here today to talk to everyone about dysphagia and hopefully get some good dialogue and communication with you all to answering any questions you might have. A little bit of background about me is, as Catherine said, my role is within ITF Pharma as a medical science liaison. And my goal is just to provide disease state awareness, education, and share scientific information as it emerges. I am a registered nurse by trade, and I've been a nurse for the past 11 years, and the entire time, my focus has been in neuroscience with the last 2 years solely dedicated to people with ALS. So I'm really happy to be here to chat with you all today. So jumping right in, dysphagia and ALS. So what is dysphagia? The word dysphagia first appeared in the medical literature starting in the late 1800s, and it's a combination of Latin and Greek. Dys means difficult or bad, and phagia means to eat. So dysphagia literally means difficulty with eating and difficulty with the sensation and abnormality in swallowing. Some of the common symptoms of dysphagia, and I just kind of want to give the disclaimer that each person is unique and might have different symptoms, but a lot of what we see is that folks are having coughing issues, especially on liquids or foods. It could be painful swallowing and the inability to swallow completely, a sensation that you have food stuck in your throat or your chest, hoarseness. Some of the other things that we hear are frequent heartburn and drooling of saliva or liquids, just to name a few. Other things that aren't so evident or aren't on this list are signs of malnutrition, like unexplained weight loss or unintentional weight loss, and then even taking a little bit more time to finish your meals or noticing it takes longer for you to finish your meals. So those are some of the common symptoms of dysphagia. And this is a very informal presentation, so I'll kind of ask the first question, have you all or anyone on this call experienced any other symptoms of dysphagia than listed here? Okay. We can talk about that later. I'll move on. So I do want to talk about the basics of swallowing and what kind of goes on in our bodies step by step. So swallowing requires many muscles and nerves working together to move food and liquids from your mouth to your stomach. And if you look to the right of your screen, you'll see the illustration there of all of the organs in your mouth and in your throat that have to work together with muscles, both sensory and motor neurons, for you to swallow. The voice box or the larynx plays an important role in your swallowing, and it sits on the top of your neck, and it prevents food and liquid from entering into your windpipe. When you swallow, your voice box raises up so food goes into your food channel and not through your windpipe. And so I'll kind of point with my mouse here. You'll see the larynx, your voice box is here. And then your esophagus or food channel is kind of tucked away in the back. We haven't talked about the trachea just yet, but I do want to point out that in this illustration, the trachea sits in front of the esophagus. So that's your science and your anatomy and physiology lesson for today. If food or liquid goes past your voice box, it can enter into the windpipe and go into the lungs. And this is one of the most common complications of dysphagia. It's called aspiration. And so we'll talk a little bit further about aspiration and even silent aspiration and what to look out for. I have a video here of dysphagia for you, and this is a video fluoroscopy of a person swallowing some pudding. The pudding in this video should be only going down the food channel, and that's that tube that I pointed out that was behind the windpipe or the trachea. However, I want you all to pay close attention because the pudding is going down the windpipe or the trachea. This person has dysphagia and their cough reflex is not working properly. And so when we have food that goes down the wrong pipe or a windpipe, what should naturally occur is we should feel a sensation that doesn't feel quite right. It could be a tickle. It could just not feel right. So we should be trying to expel that out of our windpipe or cough. So I'm going to go ahead and play this video here. So you see as the pudding is going down the throat, and you see here in the back, we have the esophagus, but in the front, unfortunately, this person is aspirating that pudding and it's also going down the windpipe. And what's important to notice is this person, it doesn't look like from this video fluoroscopy, this person is trying to expel that pudding back up. Okay, so we're going to take a closer look at that video. Kind of plays quickly, but again, just notice how the pudding is going down the wrong pipe, the windpipe, and instead of into the person's stomach. So again, this is called silent aspiration because we do not see this person coughing after this happens. And I'll kind of pause here for a moment if you have any questions. Okay. So switching gears to talk about how common dysphagia actually is. As a nurse, this was even very eye-opening to me. So this first circle or pie chart here, it says dysphagia, 98% in bulbar onset. So what that's saying is 98% of people who present with bulbar ALS have dysphagia. 2% do not. 77% of folks who present with limb onset ALS have dysphagia. So that makes a combined 83% of people who have ALS are going to experience dysphagia at some point within the disease progression. So 5 out of 6 people. Why does dysphagia occur? So it doesn't happen overnight, and a lot of people don't even notice that they're experiencing symptoms of dysphagia because it is so subtle. Our bodies are so remarkable, and we're able to adapt and compensate for small changes along the way. And so people might not notice and just adjust to the small changes that occur in their ability to swallow. In taking a closer look at silent aspiration. So with silent aspiration, it's believed that one of the main reasons that people develop it is because their nerves that are responsible for swallow or sensation in their throat or voice box become damaged. So once the sensory nerves are damaged, you can't feel foods or liquids adequately enough to know that they're going down the wrong pipe. And that in turn puts you at an increased risk of aspiration pneumonia. Some of the complications of dysphagia, and I kind of touched on this earlier, the number one complication is aspiration pneumonia. And with aspiration pneumonia, it's the second leading cause of issues with comorbidities, and the main one being respiratory failure. 1 out of 3 folks experience that. And I also want to point out on this slide, I know it's kind of busy, but it's estimated that 7%, and this is the last bullet here, 7% of all foreign objects aspirated are caused by peels. And so the number of folks that are aspirating on peels is unknown, but it accounts for 7%, so quite a bit. So how do we assess for dysphagia in ALS? And what I found is each clinic is slightly different on the assessment tools that they use, but one of the assessment tools that many clinics use is called the ALS Functional Rating Scale Revised. And so this scale, and a lot of you might be familiar with this, has one question on swallowing. And it evaluates swallowing by giving a plus number. +4 is completely normal, normal eating habits. +3 is you're experiencing early eating problems, maybe some occasional choking. +2, you're noticing dietary consistency changes, and that could be maybe nectar thickened liquids or pudding consistency. +1 is you're now needing supplemental tube feedings, and 0 is completely nothing by mouth. I want to introduce another tool to you. It's called the EAT-10, and EAT stands for Eating Assessment Tool. This tool emerged in 2008, and this is an article here that focuses on making this tool valid, showing that after testing this tool out on many people, it's reliable in showing that a person has swallowing difficulties or not. So the next slide we'll go over, or we'll just kind of take a glance at the 10 questions on the eating assessment tool. But this is a nice tool because it's something that you can do yourself. You can just read the questions and circle the number, and it's something that your healthcare team can do for you as well when you visit them. And again, it's been studied in people with ALS and shown to have excellent accuracy in identifying aspiration. So the EAT-10 questionnaire is featured here on the right side of your screen. And you'll see there, it's just the 10 questions, and you would rate yourself from a 0 to a 4. 0 being no issues at all, and 4 being a severe problem. And number 1, I'm just going to read a couple, states, my swallowing problem has caused me to lose weight. And then you can kind of glance through the other questions there. The EAT-10 helps your doctor understand if you're having difficulty swallowing. And I just want to give the disclaimer that this tool isn't equivalent to a clinical swallowing test. Definitely not equivalent to the video of the fluoroscopy that we saw earlier with the person choking on the pudding or aspirating on the pudding. You always want to go to your doctor and your healthcare team so they can determine if you're having issues with dysphagia and what direction to take. So in summary, dysphagia is very common in ALS, affecting approximately 5 out of 6 people. And it is directly related to ALS due to the progressive changes in the nerves that control the swallowing. It's associated with malnutrition, dehydration, and as we stated before, aspiration pneumonia. It's a need to early detect and monitor if you're having any abnormal swallowing issues, as you know, because it will help improve your quality of life. The better that you and your healthcare team can get ahead of these things, the better you're going to feel about things and the more control you're going to have. And the EAT-10 questionnaire has been tested, as I stated before, in folks with ALS in identifying risk for aspiration and just identifying if you need a further swallow evaluation with your healthcare team. And that concludes my presentation. Thanks so much.
And we'd like to open it up for questions if anyone has any. If you have a question, You can either unmute your microphone and just verbally ask that question, or please feel free to also put any questions that you may have in the chat. We have a question here from Jack. Assuming aspiration, how do you evaluate effects on lungs?
That's a great question. So there are many different tests to look at lungs. One of the main tests that I've heard about is a chest x-ray. But if you're thinking that you're having issues with aspiration, especially silent aspiration, because that's the type that you don't feel anything off is happening, you might check with your doctor and see if they want you to take any furthering swallow evaluations or even further testing for your chest other than what I mentioned.
A few more questions here, two around the same topic. Are these illustrations available to print out, especially the EAT-10 test, and how do we download that test?
Thank you for that question. So the illustrations, I know that they will be available and via this recording, but I can get with Catherine and send those out if that's something that you all are interested in, as well as a separate attachment of the EAT-10 tool that you would be able to print out.
Great. Another question from Raquel and Jennifer. My mom was asking what type of doctor would be recommended for her, a family doctor or a neurologist?
That is a tough question. I know in my role, I wouldn't be able to share necessarily my opinion, just the facts with ALS disease process. I would say if you're finding that you're having issues with dysphagia, let a physician know, and maybe they can help you or work with your healthcare team to determine if you should see a specialist and which specialist you should go to.
I've got a comment here from Dutch. Great job, Shakina. Thank you. Anita also says thank you.
Thank you. My pleasure.
Does anyone else have any questions? Please feel free to put them in the chat, or you can unmute your microphone and ask. Oh, here's another one from Dorothy. Recently, I was having swallowing problems and my gastroenterologist dilated my esophagus. Is this standard?
I don't know if it's standard. That would be a good question for your neurologist, I would say. I haven't heard too much about that.
Does anybody else have any other questions? Oh, here's another one from Diana. Do you recommend one type of thickener over another to aid with swallowing liquids?
That is a great question. My first question for you would be, Diana, are you seeing a nutritionist or a registered dietitian? I would say those folks, along with your physician, better than anyone would be able to recommend what diet consistency would be best for you, depending on what swallowing difficulties you're seeing. As far as any brand over another, I know that there's a few out there, but I don't recommend one over the other.
Another question from Anita. My husband has started noticing more drooling. Any suggestions to slow the progression?
That is a great question. Again, I will be sending Catherine the EAT-10, and as I mentioned, the EAT-10 assessment tool, and as I mentioned earlier in the presentation, drooling is one of the symptoms that we see with dysphagia. And so if you haven't already, I would bring that to your neurologist or your healthcare team's attention and see if there's anything that they want your husband to do in light of diet consistency changes or assessment wise or even resource wise? That's a great question.
And then John asked, is excessive saliva symptomatic of dysphagia?
Sialorrhea or excessive saliva is one of the symptoms of dysphagia and ALS in general. So I would also, if you haven't already, make sure that you let your physician and your healthcare team know that you're experiencing that, and see what direction they give you there. It's a great question.
Well, is it on now? Can I talk?
Yes, please.
Okay.
Hi.
Will the feeding tube help the secretions? Or I guess he'll still have the same secretions because his body will still be making it. Will there be any less secretions when he has a feeding tube?
So that's a difficult question to ask, because what you stated before, it's his body that
Right.
is making the secretions. It's hard to know if he's taking nothing by mouth, if that will change or not if you were to get a feeding tube. But again, I would say for that specific question, that would be best asked by a speech language pathologist or the nutritionist or even his GI doctor in his healthcare team who's going to be doing the procedure.
Thank you.
It's a great question.
I have a question from Diana. How much does positioning when eating or drinking contribute to some swallowing difficulties, i.e. sitting up straight, etc.?
Great question. So when you're eating or drinking, it would be best to have positioning that would contribute to you not aspirating. So lying down would probably not be the best idea. I would probably say that sitting up would be best when you're eating or drinking. And I know that in my prior experience in working in the hospital, especially with folks that were receiving tube feedings, their head of bed in that particular hospital protocol was to have it at 30% or more. So I would say you would want ergonomically to sit up when you're eating. But again, I would defer any specific questions about your situation to your healthcare team. Those are the folks that are best equipped to give you the knowledge and direction there.
Do we have any other questions? We'll wait just a minute more and see if anyone else has questions.
Okay.
Oh, here's one from Dutch. I struggle with thin liquids like water, coffee, or iced tea, and thickener helps a lot. That's good to know. Thank you so much for sharing that, Dutch.
Yes.
Another question from Diana. Do you recommend keeping intake of solids versus liquids separate? For example, eating solids and swallowing liquids maybe a few minutes apart.
That's a great question, Diana. And again, it would depend on what your nutritional goals are specifically. And nutritional goals, I know, go in depth with caloric intake. It doesn't just stop at things like consistency. Timing of your meals plays a big part in that too. So I wouldn't, again, be able to make a recommendation one way or another, but I would say take that question again to your nutritionist or your dietitian, and they would be able to give you the best direction specifically in your case. That's a great question.
Great. She says thanks.
Thank you.
All right. Let's see. Oh, another question here. Is coughing a positive indication that patient is clearing the airway?
So coughing after, it depends on when your coughing happens. A cough in general is good because it means that you can effectively clear your airway. I would say pay close attention to when you're coughing. Are you coughing close to when you're having your meals or you're finishing your meals? And I would also not only pay attention to the timing, but the frequency. Is it that you're clearing your throat a time or two, or are you having an intense coughing spell after you're eating? Those are things that little nuances there that you want to pay attention to and make note of so you can report it to your healthcare team. Great question.
A comment from Colin. For me, the thickened liquids help me get the solids down. I use Simply Thick as my thickener. Thank you, Colin, for sharing that. Okay, I think that's the end of our questions. Thank you so much for, oh, wait, one more. From Raquel and Jennifer, does spicy food cause coughing?
That is a great question. I would say it probably depends on who you are and what your palate's like, but I would imagine, nursing aside, that spicy food would or could cause coughing. So not only in addition to noticing when you're coughing, but noticing what foods, if any, make that happen more often. It's a good question.
Dutch has a question here. He says that foods with a combination of solids and liquids can also pose a problem, i.e. cereal and milk, vegetable food. Any suggestions?
That is a great point that you bring. I don't have any specific suggestions there. There might be options for you, especially when it comes to some of the thickened liquid options that we mentioned earlier on the call or earlier in the questioning.
He clarified vegetable soup. That makes sense. And Raquel and Jennifer said thanks.
Yes.
I'm going to pause just a minute more and see if anyone else has any questions. And again, please feel free to put them in the chat or unmute your microphone to ask. All right, well, I think that's it. Thank you so much, Shakina. We really appreciate you presenting today and helping us understand more about this and how it affects people with ALS. Please join us next time. We have our next presentations on May 12th at 1 o'clock, Maintaining Independence at Home. And you can see more information about our future virtual events at alstexas.org/virtual events. And so sorry, Shakina, I think I cut you off there.
No, I was just going to tell everyone who attended, thank you so much. It's been a pleasure chatting with you all and presenting to you. And my promises are going to be the illustration within the slide deck that someone asked for, and then also that EAT-10 questionnaire tool. So those will be sent over as soon as I can. Thanks again.
Wonderful. And we'll send out those items that she mentioned along with the recording of this presentation to the email that you registered with afterwards. Thank you all so much, and we hope to see you next time.